Well, government has started enforcing measures at the country's airports to prevent the spread of COVID-19. Foreign visitors on a flight at OR Tambo International Airport were prevented from disembarking earlier today. It comes as SAA cancels a number of international flights. Meanwhile, Health Minister William Kize says the number of patients infected now increasing, as you just heard, to 202. To discuss all of this, I'm joined by our reporters Barry Bateman, Heidi Jakos, Maseko Ratlacha, and Sekho Ajomoaki, all live now. So Barry, let's start with you. Of course, we heard that police will be monitoring, of course, restaurants, taverns to ensure they don't breach these new regulations in place. But what else is the police minister announcing that would be the requirement to help track and trace potentially infected people? Tell us more about that.
Yeah, good afternoon, Shahan. As you quite said there, the police seriously ramping up efforts to try and ensure that these regulations gazetted earlier this week will be adhered to. We're hearing about spotters that will be outside restaurants throughout the country to ensure that there's not a single drop of alcohol on tables after 6 p.m. But there was, of course, a new requirement that was announced by Police Minister Bheki Cele today, which I think is aimed at assisting the health authorities in the event that new cases emerge. You would have recalled whenever we hear from Health Minister William Kize that there are these tracking and tracing units that try and locate all the different people. Well, take a listen to what Minister Bheki Cele has asked the restaurant owners to do as well.
These places of food, they must have register for the people that are coming there, so that there is a traceability. If we find that there was somebody that in this particular time was there and was found to be positive, were able to trace other people that were there. So they'll have to keep the registers so that police, as they come at any given time, they find those registers and they are able to trace the people that were supposed to be there.
All right, Heidi, let's go to you at OR Tambo International Airport. SAA putting measures in place to try to also help not spread COVID-19. And also tell us about those people who landed in South Africa but told not to get off those planes.
Yes, indeed, Shahan. SAA has decided to cancel all its international flights, including 2 flights to which are not from the high-risk countries, which are Sao Paulo and Perth. They have decided to suspend these international flights from the high-risk countries and those 2 countries, given the fact that the President has implemented this travel ban as of Wednesday. And as an airline, they are trying to mitigate any kind of spread of coronavirus, given the fact that travellers seem to be bringing it in or out of any particular country. So we do understand that SAA has taken those measures. However, they are still going to fly regionally and domestically. They will continue their 1 flight, which is to Cape Town. Those are the measures taken, and they say it's all got to do with the fact that there is very low demand and because of the travel ban. When it comes to those passengers that landed at OR Tambo International, we understand it's 14 aircraft which are from the high-risk countries. We're not exactly sure from exactly which country. We do know British Airways is there, as well as an aircraft from Switzerland. But these aircraft had passengers from these high-risk countries, as well as South Africans. We understand that South Africans have been allowed to disembark, but when it comes to the foreign nationals, they have not been allowed to do so. Airports Company South Africa is attending to those South Africans through Port Health Services to check symptoms of the South Africans, whether or not they have any symptoms, that's concerning. But the aircrafts will be sent back. It's all dependent on when a line will be opened up, but all those aircraft will not allow any foreign nationals to disembark, and they will be sent back to the countries where they come from. These are just some of the measures that have been implemented, and we're expecting a briefing from the Minister to get more clarity on why they were allowed in the country in the first place.
Yeah, so Maseko, of course, we also hear from the Health Minister almost daily on COVID-19. The cases are rising by the day, but what's the Minister saying the government is doing to actually make sure no one dies of the coronavirus?
Well, Shahan, that is really government's task at the moment, isn't it? Because the virus is already here, and we can see in the past 3 weeks, that day when we started with one case in KZN, how it's rapidly grown and how Gauteng remains sort of the epicenter of where, the coronavirus is confirmed. So we did ask the minister what it is that the government is going to do, Shahan, to try and make sure that South Africa does not record a death. Other countries have recorded some deaths, and even some in the African continent also confirming some deaths this week. And the minister was saying that they are already, as government, trying to prevent deaths. He says some of the steps that they've taken, for instance, speaking to both the public and private health fraternity or facilities to make sure that there are beds available for anyone who displays the symptoms or who's confirmed to have the virus. But Shahan, here is exactly what it is that the minister said the government is doing to try and make sure that we don't record any deaths.
If you treat patients, you're trying to prevent death. When you test patients, you're trying to prevent death. When you get a doctor to look after the patient, you're trying to prevent death. When you are providing hospital beds, you want to try and prevent death. When you provide ICU and ventilators, you're trying to prevent death. We've done all of those things. We've not had to need to take anyone to ICU.
Sekho, of course, you've been speaking to the Human Rights Commission about COVID-19. What are they saying?
Well, good afternoon, Shahan. So their main concerns is, of course, around the health care of this particular, of the province of Gauteng. They did mention that they are concerned about issues such as what is happening at some of the hospitals, the structural issues at some of the hospitals. They are saying that, however, this time will actually give the province the opportunity to see if they are actually ready to roll out the NHI. But they are saying that the inequalities in the healthcare system just seems to be growing more and more. They are also concerned about the structural issues at places like Charlotte Maxeke and the infrastructure at some of these hospitals, saying that they're concerned if they will actually be able to handle if there's an influx of patients that they need to take care of.
Yeah, so Barry, of course, yesterday I asked you about how authorities plan on cracking down on restaurants and stuff to see how they monitor these new law enforcements. Today you actually went to get an answer to that question from the Minister of Police.
Yeah, Shahan, it actually related to the issue of fake news and the disinformation that could be spreading. That has now been criminalized. Now, it's easy enough to send people out to go and monitor restaurants. How then do you keep an eye on social media where, there's nameless, faceless trolls? I put the question to Minister Bheki Cele. This is what he had to say.
It might take some time, but police do have the capacity of chasing fake news. We do have the units in the South African police that can trace the origin of the fake news and how far has it spread. So if it is declared a fake news, we will check that, we will trace it, and you know what this law says about fake news. But police, with other agencies within the security cluster, I'm sure your state security and all that, we do have capacity of checking on these things.
All right, Heidi, back to you. Of course, the Transport Minister expected to speak at OR Tambo in about half an hour or so. We'll take that live on ENCA. But the question is, why were planes allowed into the country when we know that since Wednesday they weren't supposed to come here?
Exactly. It's such a vital question that the minister needs to answer to. We do understand from an indication that we got from Airports Company South Africa that even though the president put a travel ban on effective of March, 18th of March, which was on Wednesday, it takes a bit of a while for this to trickle down to all the airlines in all the different countries and for it to be properly gazetted and regulated. And it appears as though people were still able to book on the airlines. from these high-risk countries coming back into South Africa. The big question here is also how many people are we looking at? How many people we're trying to get into the country from these high-risk countries, as well as the South Africans that were on those aircraft from these high-risk countries? Will they be quarantined? Even though they are being tested by port health services, one understands that you may be carrying the virus and you will only be seeing symptoms in about 14 or 21 days. So we need to get an indication on what they plan on doing with these South Africans that have come back into the country, and how they are going to make sure that they stop any other aircraft from coming into the country. Like we've seen today, we're speaking about 14 aircraft that have attempted to come here and disembark a number of passengers.
Yeah, so Maseko, of course, there are 7 cases in the Free State. There are pupils who are being called back to be screened. Tell us why.
Well, Shahan, it was quite a scary experience for some of those living in the Free State, and especially those whose children go to that school. So, Shahan, what happened in the Free State is that 5 cases were first of all reported. Those people were coming to South Africa internationally. They landed here around the 11th of March. Some of them were from Texas in the United States. Some of them were from France. So different parts of the world, really, when they arrived here. And it was reported that those 5 people probably have coronavirus because they were displaying some of those symptoms. They were tested positive, but by then, Shahan, it was already too late, because they had already attended a church service with about 200 to 300 people. So those people still need to be traced and found. And then after that, they went and they were quarantined at an Airbnb here in Bloemfontein. So it means the staff there also have to be tested and probably also isolated. Actually, some of them have already been isolated at that B&B. But Shahan, coming to the school, it's a nurse. One of the 7 people that have been confirmed here in the Free State is a nurse. She has 2 young children who go to a school called Brandwag Primary School here in Bloemfontein. And because of that, that school had to then, call all the parents to tell them, as you remember, Shahan, the president saying that schools had to be shut down from Wednesday in South Africa, and therefore they had to call the parents back to be screened today. And here's the district manager of Mangaung, of the education department in Mangaung, explaining what happened there today.
All the role players, we gathered at school here today, and then to address all the stakeholders. The minister managed to allay the fears of the parents, and then with regard to this COVID-19. And all our leadership, really, they played a pivotal role in ensuring that, and then the school community, and then is being addressed, and all the necessary precautionary measures, and then have been taken. And then today, and then we met with in the excess of 476 parents, and then about 1,000 learners who came, and then just to be screened. The screening went very well. We just finished now, and then we got a report from the health department and a team, and then which was assembled by the minister and the premier and the MECs, and then they really did a splendid job. And then the parents are now more calm, and they just need to make sure that then they continue and then exercising and then all the precautions which is needed in order to prevent and circumvent and then this COVID-19.
Seko, we'll end off with you. Tell us what HRC officials are saying about the healthcare facilities, especially the public ones that are being used when it comes to dealing with COVID-19.
Well, the main concern, Shahan, is hospitals like Charlotte Maxeke, where there were some complaints there, issues of infrastructure, issues of healthcare workers that are there that are actually not being taken care of. Those are some of the concerns that they've raised about how exactly is the Gauteng government going to actually deal with this if it gets any larger than what it already is at the moment, COVID-19, that is, if more cases are reported. They've also flagged issues such as the Tembisa Hospital Hospital. We've heard a lot of cases at the Tembisa Hospital, and of course the Minister and the MEC of Health really just trying to allay fears of those that will be isolated or quarantined at those particular hospitals. And we also know that the issue of Jubilee Hospital in Hammanskraal has also come up, and it's also been a huge problem. So they are highly concerned about some of the hospitals in the province, and they are saying that a lot still needs to be done before a lot of them can actually even think about quarantining some of the patients that might need quarantining in the province.
All right, we can leave it right there. Sekho Ajumoahi, Maseko Rahlacha, Heidi Jacos and Barry Bateman bringing us every angle on COVID-19 in South Africa.